Many of the approximately 37 million Americans who have diabetes will go on to develop other health issues as a consequence of this disease. And the musculoskeletal system is one of the important biological systems that is affected negatively and thereby will cause a diminishment in quality of life. So in this video, I'll review how diabetes can go on to cause muscle atrophy, muscle weakness, and even reduce functional ability. And of course, I'll discuss how exercise can be used to help prevent these problems and address these issues. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. Type 2 diabetes has been shown to be associated with both muscle atrophy and muscle weakness in older people who have diabetes. And for example, there was a study of about 2,600 older adults, and they were followed for 6 years. And they found that the thigh muscle and the mass of the thigh muscle, which was measured by cross-sectional area, declined twice as fast in older women who had diabetes than their non-diabetic counterparts. Similarly, in another study of older men with type 2 diabetes with an average age of about 71, they also found that muscle strength had been reduced. And they looked at both lower extremity and upper extremity. And they found that lower extremity strength had been reduced by about 8%. And upper body strength, as measured by hand grip strength, was lowered by about 13%. Although the exact mechanism of how diabetes affects the muscles causing atrophy and weakness is not known, there are some theories that have been put out. With regard to muscle atrophy, one of the theories is that muscles aren't able to produce proteins that are necessary because of the insulin-resistant state. Another theory is that being in hyperglycemia could cause oxidative stress and inflammatory response in the body, which may also affect the muscles and cause atrophy. Now, with regard to muscle strength, there are also other theories. One of these theories is that the hyperglycemic state can affect the mitochondria. Those are the little energy powerhouses in the muscle cells. It may affect them, so therefore it would affect the strength of the muscle. There are other theories. One is that because in diabetic patients, their arteries sometimes will get clogged, and therefore the blood flow out to the muscles may be diminished, and therefore that would affect muscle strength and muscle atrophy. Another reason why diabetic patients may end up with muscle weakness or atrophy is from what's called diabetic peripheral neuropathy, in which the nerves are affected, and this nerve damage can actually cause weakness in the muscles. And many patients will also often describe a loss of feeling in their extremity. There was a study of about 1,400 diabetic patients, and they found that among both men and women between the ages of 50 and 69, that those with peripheral diabetic neuropathy had about an 11 to 13% lower muscle strength compared to those who did not have this peripheral neuropathy. And then there was another study that looked at people between the ages of 70 and 87, and they found that those with this diabetic peripheral neuropathy had also about a 12 to 17% reduced leg strength compared to those who did not have the peripheral neuropathy. Functional performance is also impaired in patients with diabetes, and functional performance might be things like gait speed, ability to walk up a flight of stairs, or get up from a chair. And for instance, there was one study that looked at older people with diabetes, and they found that the time it took for them to get from a seated position to standing was 17% longer than those people who did not have the diabetes. Now, how common of a problem is this in diabetic patients? So there are several studies that have looked at this. So for instance, one study, a study of about 8,000 women who were age 65 or older, found that the yearly incidence of disability in those with diabetes was about 10%, compared with less than 5% in those without diabetes. Now, this data was corroborated by a meta-analysis, and in this meta-analysis, they also found that the risk of having a physical disability, difficulty, again, like walking or doing activities of daily living like bathing and washing and things like that, for adults who had diabetes increased by about 50 to 80% compared to age-matched individuals who did not have diabetes. Exercise plays a pivotal role in people with diabetes. In addition to the fact that it helps prevent diabetes, in those patients who already have diabetes, it can help reverse muscle weakness and can help improve physical function. One study looked at this, and this was a study of patients who had diabetes and were 65-year-old, and they were randomized to an exercise program doing resistant weight training type of exercises. And they were doing these 3 days a week for about 12 weeks. And they found that this exercise regimen improved both upper and lower body strength. And in addition, they also found that it was able to help improve function, which they saw as a reduced amount of time it took for them to get up from a chair. This data is corroborated by another study, a meta-analysis of diabetic patients, average age of 45, and they found that doing an exercise program also helped improve physical function. And this was seen by those patients, how far they could walk in a 6-minute test, how quickly they can get up from a chair, or how quickly they can get up from a chair, walk a certain distance, and come back. All these had improved with an exercise program in diabetic patients. Let's wrap up this video and go over a few key points. Number 1, diabetic patients often have reduced muscle mass and muscle strength. Number 2, diabetic patients are at increased risk for physical limitations, some loss of physical function, which may be seen as things such as reduced ability to walk or go upstairs. Number 3, exercise is critical in diabetic patients, not just for prevention, but to also help maintain strength and maintain physical function. Thank you for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.